Hi, I'm Dr. David Josephitis, and I'm going to be discussing a little bit about women and hair loss. And are they good candidates for surgery or not? Now, both men and women suffer from hair loss. It's just that we usually see a lot more men with thinning. And why is that? Well, typically men and women lose hair in different ways. Men tend to lose hair in the corners here, in the crown. Women tend to have more of a diffuse loss throughout. It's a lot different. Also, women are a little bit better at concealing hair loss with products or hairstyling methods. So in general, there are quite a bit of women out there that suffer from hair loss, just like you who may be watching this video. So are there solutions and help for you? Well, in our clinic alone, we do about 15% females, and the rest are men. And the reason that is not because there's less women, as I mentioned to you before. It's that women are not always the best candidates for surgery. And there's a couple of reasons for that. One is, along with this diffuse thinning that a lot of women have in the front and top, that diffuse thinning where there's gaps and spaces where there's little hairs, the same occurs usually in the back and the sides, so it's usually everywhere. More men than women have more hair in the back, in the donor area. And remember, if you've watched any of these videos, or any videos on hair transplant surgery, you know that it's important to have a good, rich supply of donor in the back. So the donor area needs to be very nice and thick in order to do surgery. So women who don't have this are going to be very poor candidates for the surgery. There's really no hair in the back to donate to the top, and that's the problem. So women with these types of situations are best served otherwise. And medications are a great first step for women as far as trying to prevent further loss and also potentially getting some hair back. Minoxidil is one such treatment. Also, low-level laser therapy is another common treatment that women reach for their hair loss. Now, if you have thinning on top, but you still have good donor supply, you would most likely be a good candidate. And so it's important to see a hair transplant surgeon to evaluate you. So in addition to those who have a good donor and thinning top, some women have very strong hair in the front. It's just that they've always had a high hairline. And so these women are excellent candidates. And so what we do is we take the hair from the back, as we do typically, and we would reinforce and lower the hairline by grafting. And the results are typically excellent. A lot of times though, when we're doing this lowering of the hairline with grafting, it requires more than one session in order to kind of increase the density. We want the transplant area density to match or approximate the hair behind it. So it's important that if you're considering doing a procedure such as this, that you're at least aware that you may need to do more than one in order to give you that final, fuller look. And so these patients are great candidates for surgery, and we see them quite often. Now, as far as the technique goes for women, most of the time we prefer to do the strip or linear harvest method. Most of the time women have a longer hair and they would like to keep that hair. And so the two methods, as you know, are the FUE and the linear strip harvesting. And for women, we typically reach for the linear strip harvest to give the patient that donor. Now, although we do the linear strip harvest for most women, some women do decide that they prefer the FUE method, and it is possible. Of course, one method is to shave the hair completely short. Of course, you have the short hair, which is sometimes a problem. But if you don't want that, currently in our clinic we can also do the non-shaven FUE for women as well. Unfortunately, the number of grafts that we can do at one time is limited, and so that's one thing. So if you have a small amount of work that needs to be done, that may be a great technique for you. If not, the linear harvest is typically the one we reach for, and usually we have excellent results using that method. So in general, there are good female candidates for surgery. It's just not as many as men, and it comes down to the donor and really what can be done. So if you have any questions, I encourage you to see your hair transplant surgeon and see what can be done. Thank you.